As COVID overwhelmed our world, we were thankful that a vaccine was developed to mitigate its devastating effect on our entire globe. As much as it was a privilege to receive the gift of a vaccine, Griffin Health felt the tremendous burden of how to widely distribute it to any and all who wished to be vaccinated. When we started to see disparities in who was getting vaccinated in our community, we started holding clinics in the underserved towns surrounding the hospital. The Connecticut Department of Public Health saw the same thing happening throughout the state in communities hit hardest by the pandemic. The Connecticut Department of Public Health's vision was to develop a program of extensive accessibility for every member in every county and every neighborhood to be vaccinated.
We traveled to every corner of Connecticut.
I've lived in Connecticut all my life, and I went to places I never knew existed. It was great to vaccinate these people.
Well, we had a lot of people that in the beginning was rushing the clinic for vaccines, where they need you, especially the elderly community.
Just seeing even the senior citizens that come in that can't complete their intake form. As a supporter and as a data entry person specialist, that gives me great joy to help them out.
With particular interest in serving socially vulnerable communities, we mobilized one of the largest vaccination campaigns in the country to reach every zip code in our state.
Incorporating data into the process allowed us to see where we needed to improve and target populations across the state that otherwise might have been forgotten about.
We went to a lot of Hispanic community centers simply because they do not have healthcare, and a lot of them don't speak English. I'm helping them fill out forms, explaining them the benefits of getting vaccinated.
It was very rewarding because I didn't come from the greatest of the background. And to be able to give back to the same communities that I was in, it was very rewarding and fulfilling.
Education has played an important part in getting the vaccine out. As teams going out to provide a service to each community.
I've seen a great response within the community. They were excited, and it helped a lot of people.
So I thought it was really great how everybody really worked together as a team to get to the places that we really needed to get to.
We're incredibly proud of the success of our endeavor. With immense gratitude to the Department of Public Health, we offer a special thank you for our partnership in helping us distribute this life-saving vaccine. Because of our collaboration, we were able to deploy 35 traveling teams in our well-recognized yellow SUVs that covered all 169 cities and towns in the state of Connecticut.
You know, for those that are homebound or doesn't have transportation, you know, we go to them where we're everywhere for someone that needs it and can't readily get it.
Well, I work very closely with DPH. They have been extremely helpful. I'm grateful that DPH used Griffin because we were the right tool. We took that opportunity and we just went out into the community and we saved lives. We really did save lives.
The most vaccines we had given at one clinic was at Fairfield University. This was a year ago during the peak of the Omicron wave. And that clinic did 586 vaccines in one day, and that number just kind of blew me away.
We launched over 11,000 mobile clinics, often setting up tents in extreme weather, and we were able to administer over 200,000 doses of vaccine to any and all who came.
I remember this lady came up to me and she gave me a packet, and I opened the packet and it was a deportation letter. She was from Brazil. And it's very sad because it could have been my family. So it's just very emotional. So she got the J&J that day, and she was crying. And it was an experience that was very sad, but like very happy because she got that. And I'm just glad that I had that experience and I had the capacity to help that woman, even though she went back to Brazil, but she had that protection.
I have had at clinics a couple people that told me the reason why they're doing it is they just lost somebody and they had wished that they had gotten the vaccine earlier so they could have visited their family member or friend before they pass away. That's the hard thing, because there's no right words to say.
I went into those communities where Those was people like myself, then people of color that was afraid of the vaccine. And when they saw other people of their same color saying, oh, maybe this is not so bad, they would get the vaccine. They built trust after seeing that people weren't dying anymore, they were living with COVID, and that's the key.
And there was a husband and a wife that needed a vaccine. The daughter brought them in, and they weren't able to come into the clinic. They have been turned away by quite a few people because they weren't able to walk in and get the vaccine. So what we did their paperwork with their daughter. We took our computers, we went to the car, we worked with them, we vaccinated them. And then one of us, the nurses that went, because 2 nurses vaccinated, and one of them just stood out there with them for the 15-minute duration. And after that, the daughter was so gracious, you know, she was just happy that we were able to accommodate them.
And it just shows that this project really did provide the resources for the communities.
Never lacking creativity, the DPH helped us find, schedule, and partner with various locations to hold these important clinics. From parks, senior centers, schools, coffee shops, and banks, to festivals, parades, town halls, aquariums, and barber shops. There was no shortage in inspiration for where and how to launch new and accessible sites. Needing extensive equipment from generators and refrigerators to laptops, printers, paperwork, and most importantly, the vaccines. The resourcefulness in logistics and sourcing was a miraculous coordination. The combined strength of local towns and press promoting every available clinic allowed us to offer vaccines to bustling cities and small towns and underserved communities. Leaving no stone unturned, our partnership with the DPH successfully reached every important town and community in our state.
You know, you are important to us as a state, as a community, and we want to definitely help you. I've gotten many people that are in tears that just are like, thank you so much for everything that you're doing.
I think our community, the state of Connecticut, has responded very well to this program, to this epidemic.
Wow, I'm honored to be a part of Griffin and DPH and the whole project because we're a team. And Griffin, it's like we open our hearts, we open our doors, we open our hands, and we go help other people.
Words simply cannot express how rewarding this work has been. Knowing that we played an important role in preserving life and the impact that we've made on those lives was well worth the hard work and sacrifice that was required along this journey.
I feel like I've been a part of history.
I think it was kind of a gift to be part of something bigger than ourselves.
That I had a driving force in being able to slow down and potentially stop the COVID-19 strain.
Such joy to know that I help people, not just the community, but within my organization as a Griffin employee.
Seeing that something bigger than what I could ever done myself, and then I could see it in the community.
Everybody in this project is a part of history.
Know that we couldn't have undertaken this enormous initiative without the guidance, direction, and leadership from the DPH. We are incredibly grateful, and so are our members of the state of Connecticut.